A 19-year-old woman with headache, fever, stiff neck, and mental status change. Case. A 19-year-old woman was admitted to the pediatric intensive care unit of the hospital in the autumn because of headache, fever, photophobia, neck stiffness, and mental status change.
Have a severe case of encephalitis. It is most often caused by a viral infection. Many types of viruses may cause it. An exposure to viruses can occur through breathing in respiratory droplets from an infected person, from contaminated food or drinks, by mosquito, ticks, and other insect bites, by skin contact with the virus. Different viruses will occur in different locations. Many cases will tend to cluster in certain seasons of the year. Encephalitis caused by the herpes simplex virus is the leading cause of more severe cases in all ages, including newborns. A number of viruses for which there is now a vaccine may also cause encephalitis. These include measles, mumps, polio, rabies, rubella, varicella, or chickenpox. Other viruses that can cause encephalitis include adenovirus, coccidiovirus, cytomegalovirus, Eastern equine encephalitis, echovirus, and the West Nile virus. The virus causes inflammation of the brain tissue. The brain tissue swells, cerebral edema, which may destroy the nerve cells, causing bleeding in the brain or intracranial hemorrhage, and thus brain damage. Other causes of encephalitis may include an allergic reaction to vaccinations, an autoimmune disease, bacteria such as Lyme disease, syphilis, and tuberculosis can also cause encephalitis. Parasites such as roundworm, cysticercosis, and toxoplasmosis in AIDS patients and other people who have weakened immune system can cause encephalitis. Cancer and its effects on the body can also cause encephalitis. Symptoms. Some patients may have symptoms of a cold or stomach infection before the encephalitis symptoms begin. When a case of encephalitis is not very severe, the symptoms may be similar to those of other illnesses, including fever that is not very high, mild headache, low energy, and poor appetite. Other symptoms include clumsiness, unsteady gait, confusion, disorientation, drowsiness, irritability or poor temper control, light sensitivity, which is termed photophobia, stiff neck and back, occasionally, vomiting. Symptoms in newborns and younger infants may not be as easy to recognize. They include body stiffness, irritability and crying more often. These symptoms may get worse when the baby is picked up. Poor feeding. The soft spot on the top of the head may bulge out more. And vomiting. What are the emergency symptoms or emergency presentation of encephalitis? Loss of consciousness, poor responsiveness, stupor, coma, muscle weakness or paralysis, seizures, severe headache, sudden change in mental functions, like a flat mood, lack of mood, or mood that is inappropriate for the situation, impaired judgment, inflexibility, extreme self-centeredness, inability to make decisions, withdraw from social interaction, less interest in daily activities, memory loss, and impaired short and long-term memory. What are the signs and tests done for encephalitis? The examination by a physician may show abnormal reflexes, increased intracranial pressure, mental confusion, mouth ulcers, muscle weakness, neck stiffness, signs in other organs such as the liver and lungs, skin rash, and speech problems. Tests done include an MRI, or magnetic resonance imaging, A CT scan of head and culture of the cerebrospinal fluid, or CSF, blood, urine, and other cultures. An EEG or electroencephalogram, a lumbar puncture for the examination of the CSF fluid. Tests that detect antibodies to a virus like serology tests may also be done. And tests that detect tiny amounts of DNA by PCR for that virus are also done. What is the treatment? The goals of treatment are to provide supportive care, rest, nutrition, and fluids to help the body fight the infection and to relieve the symptoms. Reorientation and emotional support for confused or delirious people may be helpful. Medications include antiviral medications such as acyclovir or Sovirax, and to treat herpes encephalitis and other severe viral infections. However, no specific antiviral drugs are available to fight the encephalitis. Antibiotics are done if the infection is caused by certain bacteria. Anti-seizure medications such as Dilantin to prevent seizures. Steroids such as dexamethasone to reduce the brain swelling, which occurs in rare cases. Also, sedatives to treat the irritability or restlessness. Acetaminophen and Tylenol for fever and headache. If brain function is severely affected, interventions like physical therapy and speech therapy may be needed after the illness is controlled. So what are the expectations and prognosis of this disease? The outcome varies. Some cases are mild and short, and the person fully recovers. Other cases are severe, and permanent impairment or death is possible. The acute phase of disease normally lasts about 1 to 2 weeks. Fever and symptoms gradually or suddenly disappear. Some people may take several months to fully recover. What are the complications of encephalitis? Well, permanent brain damage may occur in severe cases of encephalitis. It can affect the hearing, the memory, muscle control, sensation, speech, and vision. When to call your healthcare provider? Well, if you have any of the symptoms mentioned above, you think you might have encephalitis or a family member thinks you have encephalitis, you should be evaluated right away. You must go to the local emergency department or call 911 if you have sudden fever or other symptoms of encephalitis mentioned before, severe headache, changes in mentation, neck stiffness or soreness, etc. That's it for the discussion of encephalitis. See you soon.
Diagnosis: meningoencephalomyelitis. The patient's presentation is most consistent with meningoencephalomyelitis with an infections or inflammatory cause. Symptoms: headache, fever, photophobia, neck stiffness, mental status change.
So, I'm going to show you 4 cases which have identified the answers for, but hopefully as we go through this, as you recall some of the things that might be so I think you know the cases, you'll be able to identify or at least think about what you would do for them or what could be going on. And we're just going to review a bunch of things. Some of these I probably will move forward kind of quickly since this is a review. The first is an active 78-year-old man who has history of motor valve replacement. Years ago presents with fever and liver confusion and dehydration. Initial concerns that he could have subacute bacterial meningitis, but the dual puncture because of confusion in his age. And they find that his CSF and PNC is just a neutrophil count, so it'd be like a white count, same thing. Is 20. So, a little elevated, but not immensely elevated. History of sodium 128, let's go start with the negative. What would you think about? What's the differential diagnosis? What's going on with him? 85-year-old who has severe neck, who committed a fever, maybe a stiff neck, it's tough to know. And worsening confusion on lethargy is just X-ray and you're negative, what do you want to do? Does this sound like concepts that we get on infrequently? Usually. 75-year-old presents with personality changes, confusion, and agitation, no fever, and no other evidence of infection. What do? We get consulted. Is there anything we should be doing? An 80-year-old man presents with low-grade fever and coma after several days of myalgias and viral-like illness. His exam is notable for some Parkinsonian type of features. What's your initial concern going to be knowing that? So there's a lot of different things going on, and you can imagine all these cases must tie into the title of the presentation, meningitis, encephalitis, and compassion. Just to remind you that meningitis, classically, people go, well, what's meningitis? What's encephalitis? Meningitis is inflammation of the meninges, so the covering of the brain. So thinking more of encephalitis,